Mr. Chairman, what this motion does is it prevents the Medicare cuts from being used to fund a new entitlement program and would direct the savings to the Medicare program. If you could bring up slide number 3, please. Let's just see where we are from a fiscal perspective. This just shows you the trajectory of Medicare and Medicaid right there. Our two biggest entitlement programs, healthcare entitlement programs. It shows you the glide path we are on. Medicare and Medicaid together are on their way to growing to consume the entire federal budget. So obviously we have an issue with this. And so what we're simply saying is, let's not make this problem worse. In 2014, the new entitlement that's being created in this legislation kicks in. 3 years later, according to Medicare's actuaries, Medicare goes bankrupt. And so what are we doing here? We are taking $467 billion in money from the Medicare program, not to improve the savings and solvency of Medicare, but to treat it like a piggy bank to create this new entitlement for people under 65. Now, I've got a letter here dated January 22nd, 2010 to Senator Jeff Sessions. CBO says basically this: you can't count the money twice. This money coming out of Medicare is not going to Medicare. It does not increase its solvency. It is going to pay for this other new entitlement program. If you could bring chart number 2 up, please. Well, what are we looking at? According to the chief actuary of Medicare, these cuts would likely result in 20% of Medicare's providers either going bankrupt or just dropping Medicare patients altogether. Millions of people are going to lose their Medicare Advantage coverage that they have chosen and that they now enjoy. But what's worse than all of that is look at where we are right now with Medicare. Today, according to the GAO, we have a $38 trillion unfunded liability for Medicare. Now, that is a $335,350 burden for every household in America today. That's for our parents' generation, our generation, and our kids' generation. What if we don't do anything to solve this problem, say, till 2014, when this new entitlement that you're creating here today kicks in? Well, then we have a $50 trillion unfunded liability. The burden per household in 4 years is $458,900 for every household in America. This is the fiscal path that we're being placed upon. I met with a group of cardiologists the other day, and they were complaining to me about all of these cuts in the Medicare program and the problems they have with it. And we've all met with physicians about the doc fix, and we know the story there. But what they didn't realize was the $467 billion you're taking out of Medicare, not to make it solvent, but to create this new other entitlement, means that's $467 billion that can't go toward making Medicare solvent. That means when the bankruptcy hits, when the insolvency is right around the corner, which it's 7 years away, we're going to have to go deeper into Medicare to make it solvent. That means to all those physicians who are worried about what's happening, that means to all those Medicare providers, 20% of whom we're being told will go out of business, you ain't seen nothing yet. Congress is going to have to go even farther and do even more if we're going to restore any degree of solvency to this program. If you could go to chart number 5, please. And this, and my friend from North Carolina, I'm sorry he's gone, we actually thought we were being generous to your point of view by adding the World War II debt level in here. Because we have seen debt spike in this country before. We had to borrow a lot of money to win World War II. And we were able to borrow a lot of money because it was a temporary increase in our debt. But if you take a look at what's coming ahead, we have a tidal wave of red ink that is coming in this country that no major civilized country has ever seen before. This is how great empires fall. And this is the tidal wave of debt that is coming in this country. And the greatest driver of this red ink, we all know, is this program, Medicare. So if you're going to raid about $500 billion out of Medicare, put it into Medicare. Make it more solvent. Don't take the money from Medicare and use it to create another government program. If you could just go to number 8, please. Chart number 8. This shows you just how far we have to go. This shows you what kind of heavy lifting we have in this Congress. If we keep kicking the can down the road, look at what happened just in 1 year. Last year, the unfunded liability for our federal government, according to the GAO, was $62.9 trillion. That means we need to set aside $62.9 trillion today, invested at Treasury rates, so that the government can keep the promises it's making to people in America today. That was last year's number. This year, you think it went up $1 or $2 trillion? No, it went up to $76 trillion. So this year in 2010, the new unfunded liability for the federal government, the debt, the promises we're making we can't afford, is $76.4 trillion. You know, looking ahead to 2020, and I'm sure this number is going to change in the wrong direction, $83 trillion. So what you're doing is you're rating this program not to make it more solvent, not to make a down payment on this problem, not to address the incoming fiscal and debt crisis that's coming in this country. You're taking money out of this program to create a brand new open-ended entitlement. And it's a new open-ended entitlement that basically says to just about everybody in this country, people making less than $100,000, you know what? If your health care expenses exceed anywhere from 2 to 9.8% of your adjusted gross income, don't worry about it. Taxpayers got you covered. Government's going to subsidize the rest. You know, the president said at the summit himself, he hopes most people go on the exchange. I do believe that is your intention. That means we are going to explode these numbers. That means not only are we walking off a cliff, we're diving off a cliff. And that is why, if anything, if you're going to take $500 billion out of Medicare, make it go toward its solvency. Make it go toward making sure that the next generation gets a debt-free nation, not an indebted nation. The CBO told us one thing that was really scary to me, and that is by the time my 3 kids, who are 5, 6, and 8, are my age, the tax rates on them are just mind-boggling. The current 10% bracket for low-income taxpayers, according to CBO, goes up to 25%. The middle-income tax rates for middle-income taxpayers on my kids' generation goes up to 63%. And according to the CBO, the top tax rate to pay for all of this, the rate that all the small businesses pay, goes up to 88%. We know right now, irrefutably, mathematically, statistically, we're giving the next generation a lower standard of living. We are, for the first time ever, severing the legacy of leaving the next generation better off. You pass this motion to instruct, and you can actually put a down payment on that. Instead, you're making Medicare a piggy bank to create a new federal government program. And with that, I'd be happy to yield a few minutes